Drug company Pfizer in the final phase of its experimental COVID-19 vaccine. Pfizer says early data shows its coronavirus vaccine is more than 90% effective. It will submit an emergency use authorization with the FDA once its trial is completed in 2 weeks. The FDA's bar for effectiveness is 50%, so this would clear it with ease.
This is an RNA vaccine, so these are the instructions for the spike protein of COVID-19 that are injected in the arm, and then the human body makes the protein itself, and an immune response is made to it.
Pfizer says it has 50 million doses ready to go. About half will go to Americans. Coronavirus cases are rising in 26 states, with 41 states seeing a rise in hospitalizations. El Paso, Texas has now brought in 10 mobile morgues, and in Utah, hospital overcrowding has prompted the governor to issue a state of emergency and a mask mandate. Now, Governor Newsom says that the state does have a rise in cases and hospitalizations. California has promised to independently review any vaccine approved by the FDA before distribution. KION's Drew Andre is live for us at the Santa Cruz Health Department tonight. And Drew, you learned a little about how a potential vaccine would get distributed here.
Well, and Aaron, once we reach that point, the state will allocate doses of the vaccine to individual counties. From there, it will be distributed starting with the highest priority groups.
Tonight, there are promising signs a coronavirus vaccine will be available in the U.S. in 2021.
This is one of the biggest, if not the biggest, medical advance in the last 100 years.
Pfizer is one of several drug makers developing a coronavirus vaccine. But the question still remains, how widely available will it be next year? California has pledged to review the safety of a vaccine, even after it's approved by the FDA. And Governor Gavin Newsom warned today, despite a vaccine being close to approval, this does not mean the efforts to curb the spread of COVID-19 should take a back seat.
I am concerned that we may get over-exuberant because now we believe we have a safe and effective vaccine that is available, and people may go back to their original form. That would be a terrible mistake.
Local health officials say they're still working out prioritizing vaccine handouts. Nursing homes, where we saw the biggest outbreak on the Central Coast, killing 16 residents at a facility in Watsonville, are near the top of the list. The other main priorities are healthcare workers, other essential workers, those with underlying conditions that make them more vulnerable to the virus, and people over the age of 65. In an address to the Board of Supervisors, Monterey County Health Officer Dr. Edward Moreno said since there will be multiple vaccines and doses needed, the health department is coming up with plans for safe storage of the vaccines.
The fact that some vaccines may require 2 doses, so if we're going to be distributing vaccines that need the second dose, we'll need to set up a series of vaccine clinics.
And Dr. Moreno says at least initially the vaccine may not be available to children and pregnant women. And even here on the Central Coast, we're seeing a rise in COVID-19 cases. Santa Cruz County health officials say that there is a pretty good chance the county may move back to a more restrictive tier tomorrow. We're live in Santa Cruz. I'm Drew Andre, KION News, Channel 546.